Thank you very much, Associate Dean Mueller, and welcome to our new P4 students, parents, family members, friends, and faculty colleagues. It's my privilege to share some thoughts with you this evening. In my opinion, this class has more leaders, more potential than any class I can remember in a long time. Now, unfortunately, we're raging out the session. As has been said before, this ceremony signifies their passage from being classroom-based students to practice-based students. From those who learn mostly by reading books and listening to these learning professors, to those who learn by doing things in practice settings with other healthcare providers. So why do we do this? Why do we send you away to clinics and hospitals, community pharmacies? Why not just another year of classroom work? In fact, why not just stop right now with 3 years in the professional pharmacy program? So let's review for a second what you've learned in these past 3 years. So, these are just some of the books that you were required to read in the first 3 years. Starting at the bottom, your foundation, human physiology, principles of biochemistry, medicinal chemistry, pharmaceutical dosage forms, clinical pharmacology, concepts in clinical kinetics, medical terminology, calculations, non-prescription drugs, pharmacy management, pharmacotherapy, drug information and literature evaluation, and capping off with pharmacists talking with patients. What's this? Selected readings will be posted with each lecture. So it brings back a lot of fond memories, does it not? I'm sure you want to revisit all of that. And you know what? You have a lot more access to knowledge than just what's in these books. You really now have the world's information at your fingertips. But these books and your class notes, the knowledge in your head, the information on the internet, they're all necessary for your professional education. But learning facts is not sufficient for you to become a pharmacist. You also have to do things with that knowledge. Knowing without doing is like trying to get healthy by reading books on diet and exercise, or like taking a sex education class without, let's get that. So now we send you out to learn how to do things, but also to become something. And that is a healthcare professional with a set of patient care skills and the professional attitudes and behaviors that are required of a pharmacist. So briefly, what will you learn how to do in this upcoming year? First, you'll learn how to call upon the knowledge and skills that you learned in the classrooms and labs with these books and with these professors, and apply them to real live human beings who not only have diseases, but also have wants and needs and hopes and desires for a better life, just like you do, just like I do. And you'll build on this solid foundation of education you have today. You will remember far more than you did in the classroom, because caring for real patients provides the necessary context to make those neuronal connections in your brain that will stamp that experience into your memory forever. I still remember some patients that I helped care for as long as 30 years ago. I can remember specific people that I touched in some way and who also left an indelible mark on my professional career and my personal soul. And when I think about those patients, I also remember how we managed their therapy, their health outcomes, and how they felt about that experience. You will also learn that there is no single correct answer. In class, a clinical professor may have contradicted something a pharmacology professor told you previously, and you wondered, how can that be? Which one of you two is wrong? And you will learn that both are grounded in truth in some way, and that the human condition doesn't always conform to what these textbooks say. You will learn that the questions never change, but the answers very often do. Questions like, what's the best treatment for high blood pressure? Should we lower LDL cholesterol to less than 100? Is glucosamine effective for arthritis? Practice standards, treatments continually evolve, and you will learn that the knowledge you gained in these classrooms quickly becomes obsolete unless your continued learning and development keeps pace with the changes. But you know what? You'll also learn eventually a little secret that experienced clinicians know. Simply that common things occur commonly. In actual practice settings, you'll discover what is common and what you need to know off the top of your head immediately, and you'll learn what is in fact quite rare. So I recommend you spend your time learning in depth about diabetes and hypertension and lipids, obesity, depression, arthritis, COPD. Don't worry so much about pheochromocytoma. If you master the common things, you'll be able to handle 90% of what comes your way. For the uncommon things, the rare things, go back to these. You will learn the value of repetition. When you encounter common diseases frequently, little by little, you will increase not only your knowledge, but your competence in managing them with drug therapy. And as that happens, you'll also gain confidence, and your communication skills with patients and other healthcare providers will improve. You will become a drug therapy expert, and others will begin to trust you. And when physicians trust you, they will allow you and even expect you to take responsibility for the drug therapy outcomes of patients. And when patients trust you, they will follow your guidance and also allow you to participate in managing their drug therapy. About trust, you will learn that trust is sacred. Trust must be earned by giving accurate information, by correcting yourself as soon as you realize you made a mistake, and by doing what you say you will do. It doesn't do any good to ask people to trust you. You have to earn trust. We all do. And once you lose someone's trust, it's very difficult to regain it. In my opinion, if people trust you, they'll forgive a few honest mistakes. But if they don't trust you, they won't forgive you one. And you will make mistakes. What then? We all work in a health profession that's tightly regulated, carefully scrutinized, because patients' lives are at stake. Everything has to be done correctly, accurately, and precisely every time. There's no room for mistakes. But mistakes do happen because we're imperfect creatures. But the fear of failure and the dread of making mistakes can also be paralyzing and prevent us from taking sometimes the creative steps that may be critical actually to our success. So remember that hidden within every mistake is a learning opportunity. You just need to find it and exploit it. Benjamin Franklin said, "I haven't failed. I've had 1,000 good ideas that didn't work." Thomas Edison said, "Of the 200 light bulbs that didn't work, every failure told me something that I was able to incorporate into the next one." And lastly, Winston Churchill, "Success is going from failure to failure with no loss of enthusiasm." Failures, mistakes, false starts are a requirement for success. If you don't make any mistakes, you probably won't make much of anything. The only real mistake is when you don't learn something from it. And the only real failure is not having the courage to try in the first place. So be bold, get involved. The time for shadowing, observation, and exposure to things is over. Your best ally in learning how will be your volunteer and faculty preceptors. Each one can help you in their own unique way. Use them, count on them, ask them questions, seek and accept their constructive feedback of your performance. Now, you might encounter a mediocre preceptor who simply tells you what to do and how to do it. But you will have other good preceptors who explain things to you and tell you why. And you will no doubt have some excellent preceptors who demonstrate things for you and model what a good practice should be. And maybe, just maybe, you'll have a great preceptor who inspires you and whom you'll want to emulate in your own practice. So for all of these reasons, we send you away from these halls and out into the world. Your learning will no longer be restricted by a course syllabus and a fixed topic schedule, followed by exams with material soon to be forgotten. No 2 days will be alike, and you'll just have to deal with whatever the randomness of life sends your way. Now, this may seem daunting now, and May 14th, 2016 may seem distant. But this year will pass quickly, more quickly than you can imagine. Make the most of this brief time. It may be the last time in your professional life where your primary responsibility is still to learn things, to learn how to do things, and to continue developing professionally until you become something. And that's a patient care provider with the title pharmacist. The faculty and I wish you all the very best in this coming year. We look forward with great anticipation to seeing you walk across that stage at commencement on the day that you finally achieve that long-awaited goal. Thank you very much.